Hello, everyone. Thank you so much for joining us for today's webinar, reflecting on 30 years of the Revitalization Act, a conversation with SWHR's founder. I'm Katie Schubert. I'm president and CEO of the Society for Women's Health Research. SWHR is the thought leader in promoting biological sex differences in disease and improving women's health through science, policy, and education. And we're really glad to have you join us today. Before we start, I want to share just a few brief housekeeping notes. So we will be live tweeting during the event. I invite you to follow along with the conversation by visiting @SWHR on Twitter. Today's web event is being recorded and it will be posted online, and we'll be sending out that recording to everyone who registered, along with any resources mentioned in the follow-up email to all registrants. All participants have been muted, cameras are turned off. That is intentional to highlight today's speakers. To ask a question, you can use the Q&A function at the bottom of the screen. Just know we have a really short time period today, so I'm not sure we'll be able to get to all of the questions. You can also use the chat function as well. For any technical assistance, please reach out to communications@swhr.org or write in the chat, but just note that we have limited technical assistance available while the webinar is running. And so finally, we are offering a live transcription feature on all of our webinars, and you can access that feature by clicking on CC Live Transcription at the bottom of your screen. So today we are coming together on the eve of the anniversary of the National Institutes of Health Revitalization Act of 1993, which passed on June 10th of 1993, to discuss the history of women's health research and the society itself. The Revitalization Act was a historic moment for women's health research, mandating that women and minorities be included in all NIH-funded clinical research and that phase 3 clinical trials be analyzed for sex differences. The law also established the Office of Research on Women's Health within the NIH, and gave it the authority to monitor the inclusion of women in the NIH's clinical research. The Revitalization Act is just one of the pieces to the women's health research puzzle from the last 30 years, and we're excited to dig a little bit deeper into that today. Before we do that, I'd like to introduce our very special guest, Dr. Florence P. Hasseltine, one of SWHR's founders. Dr. Hasseltine is a board-certified obstetrician and gynecologist and an expert in reproductive endocrinology. As SWHR's founder and our founding president, Hasseltine wrote the mission statements, raised monies, established the bylaws, and reviewed numerous publications throughout her time here. She also hired our legacy staff. She happens to also be the founder of Hasseltine Systems, a company devoted to easing travel for persons with disabilities. She's co-edited many publications and books on a range of topics, including reproductive biology and women's health. She was the founding editor of the Journal of Women's Health, which is SWHR's official journal, and has been recognized for her contributions in the field of women's health and reproductive science by election to the Institute of Medicine and by receiving a variety of accolades, including the Wiseman Honored Scientist Award, the American Women's Medical Association Scientist Award, the Advocacy Award from Research America for the Society for Women's Health Research, and Kilby Laureate. She's received a Lifetime Achievement Awards from the United Nations Population Fund and from the Foundation for the History of Women in Medicine. Dr. Hasseltine, thank you so much for joining us. We're thrilled to have you today.
I want to actually start off with sort of the founding of SWHR. Why did you and others come together to really found this organization, and what was your initial goal 30?
Hello, can you hear me?
We can hear you.
Okay, great. Thank you very much. And this is an exciting time because the society actually was an offshoot of some efforts by a group of women really starting 35 years ago. I was hired at NIH as the director of the Center for Population Research in 1985. And if you'll recall, and some of you may, and some of you may be learning it in your history books, that in 1985 was a very active period for advocacy. It was when AIDS exploded on the field as a political issue. A lot of other activism was coming forth. The deaf community, the hearing impaired community was working with Congress to get Institute for Deafness and a lot of other things along similar lines. And what happened is when I came to NIH, it was noted that there was a very large deficiency in the number of OBGYNs, and funding for obstetrics and gynecology was in an institute, which, and it still is, the National Institute of Child Health and Human Development, that basically was designed to focus on children. And it appeared that women may have been more of an afterthought in terms of their reproductive capacity and problems related to it. But that time was also an intense period of development of a new field of reproductive biology, and that of IVF. And some of you on this call may actually have a child as a result of that new technology at the time. And furthermore, you certainly have relatives, and many members of Congress have children as a result of that technology. So the profession was changing. Contraception at that time was not being moved very far. And there were a group of us, and all of us were basically OBGYNs. Ann Wentz, Marie Bustillo, Mary Lake Poland, Gloria Sarto, all noted women, and very few of us at that time in academics, wanted to increase the amount of OBGYN research being done at NIH. And we saw these other activists doing it. But to be able to do it, we reached a sort of an impasse. People at NIH can't go to Congress and lobby for money. You have to do it through a very prescribed ritual. So to get around that, basically, we were able to hire a lobbyist. So, or as is called a legislative advocacy. And this is where two women become extremely important, and that's Marie Bass and Joanne Howes. They had a women's advocacy lobbying group and were willing to take this on. Raising money to pay their expenses was, of course, a challenge at that time, but several people contributed, and in fact, some men contributed. And so with their help, they then had a meeting at the American College of Obstetricians and Gynecologists in the late 80s. In fact, it was around the OBGYN table that, if you looked at it, was in the shape of a uterus. It was kind of amusing. I think they've gotten rid of that table. And they got together a lot of women's groups. At that time, there was a congressional caucus on women's issues that had become very active under the leadership of Leslie Primer, co-chaired by Pat Schroeder and Olympia Snow. And because they had the caucus, there were many advocacy groups that were working with them. And they got together, Joanne and Marie got them together at this meeting, and it was in the early 1989 to late 89. And they said, look, we don't really want to focus just on reproductive health issues. We want to focus on a wide range of other health issues and other fields other than OBGYN. And so at that point, it was determined that it would switch from not just OBGYN, we didn't want it to be forgotten, but that it would be much more expansive. And that's when we started working with the Women's Caucus. And I remember taking a slide projector up on one of those carts before we had wheelies, and sitting on the couch and showing the caucus how NIH was structured and how it was funded. And that's important because you can't write legislation if you don't know what you're impacting. And so to do it correctly, they wanted information on how many institutes, how the reporting was, how the budget was, things like that. So together, they were working, as I said, mainly with Olympia Snow and Pat Schroeder. But the challenge was, is these women were not on any of the appropriations or authorization committees at a high enough rank to get things activated. So what happened there was they then, and I'm not sure who it was, went to Waxman's subcommittee, and had the Government Accounting Office do an audit of NIH. That audit showed that NIH was not even following its own policies, because in 1985, Ruth Kirstein had issued a study of what NIH was doing under the guidance of the Secretary of Health, Ed Brandt, at the time. And it, in one statement in there, said women were not being included in studies, and that was making the evidence problematic that came out of it, because it couldn't be applied to women. That simple paper, or it was in a blue book, so we called it the Blue Book for a while, allowed the Government Accounting Office to audit NIH as to what it was doing. And it's found that women were not being included in clinical trials. Now, that was kind of interesting, since as an OBGYN, we were basically only doing studies on women. But it opened my eyes to the rest of the areas like heart disease, immunology, things like that. And also opened congresses. Now, alongside of all of this, we had several wonderful congresswomen who were affected by medical issues. Some of them had breast cancer, had it in the family. A new elected member of Congress who was from the district I was in Connecticut, Rose DeLaura, had ovarian cancer. And these women were all becoming aware that NIH was not sponsoring it. And under the Health Equity Act that was being considered, women weren't getting, we were paying taxes and we weren't getting studies done on issues that related to us. And Pat Schroeder particularly was also interested in infertility and contraceptive work. So what happened is, as things moved forward, in June 18th, 1990, a hearing was held by Congressman Waxman, where Ruth Katz, one of his staffers, and I'm trying to just a second, I'll get the other name, one of the gentlemen on the group, actively worked to get evidence that NIH was not doing what it had said it should do in 1985. This is sort of round robin how the things work. You get a report, you don't follow the report, then you can get called out that you didn't follow the report. So that was the first hearing. And at that hearing, I was sitting in the back of the room, and there were two things that were going on. One was that the hearing itself was particularly harsh on NIH. And at that time, we only had an interim director. And the second thing that was going on was there was a lot of press in the back of the room. And the press was really interested. It was a lot of women, and they got it. And within a very short period of time, it was all over the nation that women weren't included in clinical health. It was sort of I remember walking out of that being extremely thrilled that something major had happened and that things were not going to be the same. And then just a few weeks later, it appeared in some of the newspapers, even in the New Haven Register, where I was commuting from, that women weren't included in clinical health trials. And I felt at that point that the fire had been lit and didn't know where it was going to go, but that it was going to go somewhere. So at that point, the caucus then started to work heavily, writing up legislation. In the meantime, NIH decided to establish the Office of Women's Health. That was Ruth Kirstein in September of that year, 1990. Following that, Bernadine Healy was appointed, and probably because of the activities of both the Waxman hearing and then in August, a hearing by Representative Okar from Ohio, that they were being pushed. Why weren't women being included in clinical trials? And why weren't there actually more women involved as researchers? That was one of the subtitles. So for the next few years, the role of the society was in helping to draft the legislation that would go forward in what is called the Women's Health Equity Act. Now, it was a Republican Congress, so nothing moved for the next few years. But at the very beginning of 1993, when the Clinton administration started, the acts moved forward very quickly. And our role in it was to, and that's a society. Now, just to step back a moment, the society after the hearing did not form an operational organization. It stayed as a board till 1993. And as a board, and members of the people who were on the board with their political contacts, as well as Bass and Howes, who did the basic heavy lifting, would push issues related to women's health. Now, some of them didn't have to be pushed, like the one Pat Schroeder wanted, which was establishing contraceptive and reproductive centers. The one I specifically wanted was the loan repayment, and that was included in the original bill. That is a loan repayment for people doing research, and originally was assigned only to contraceptive and reproductive work, but later expanded. And then making the Office of Women's Health permanent. Now, to me, what was critical there was the NIH didn't want it to be permanent. They said, we've already established it, it's fine, nothing's going to happen to it. But when I heard Bernadine Healy, who was still acting as the NIH director, and we owe her a debt of gratitude for many other things, when she got in, she says, oh, it doesn't need to be in law, we'll keep it. And boy, the second we heard that, the society decided to push to make sure it was law. And that was very good, because when the next director came in shortly thereafter, he wanted to disband it. And I think that that's one of the lessons, that's an important lesson, is it's very hard to build. Remember, this build had now been taking at least 3 years, if not 10, from the time that Ruth Kirstein published that document. So with the idea that it's so hard to build and so easy to destroy, if you've got something, don't get rid of it unless there's a really urgent need. And I think that's proved important, because with establishing that by law, it created a template for doing it for many other agencies. And as a result, women's health and the diversity issues which it brings up have been very, very strong. So does that answer part of your question? It was a long-winded answer.
That answers many of my questions. Actually, I think you got a lot of my questions right. I think that, this big question surrounding, if the office were already established, and it took this many years, which I would say, yes, it does take time to get legislation like this passed and to be able to pull together a bipartisan group of members who have not just a professional stake in thinking about sort of the more public facing issues, but also the very personal healthcare issues that they are experiencing themselves. I think it actually happened relatively quickly when you think about sort of within the context of this issue moving forward. So, that was definitely one thing that I wanted to make sure that we highlighted, as well as why, if the office already existed, would we need to legislate it? And I would just add that in addition to what you said about making sure that it is always there, and that really does transcend political issues, funding issues, right? Like making sure that it's still there so that it does get funded. It has actually allowed the society moving forward and in the future years to be able to establish things like the Friends of the Office of Research on Women's Health, to really advocate for additional money and infrastructure and thinking through that topic. So I think that's been really important. The one last thing I'm going to ask you, because we're coming up on time, which I can't believe already, but I'm going to quote you to you. So back in 1997, in your women's health policy primer, you said between the research of women to health.
Sorry, I'm not hearing you.
Continue to contribute to this. Oh, you can't hear me. Okay. Can you hear me now?
No, I can hear you.
Can you hear me now? Shoot. Okay. So you had said that the choice is between doing research that will help create healthy women, particularly healthy older women, who can contribute to society, and the current situation of chronic disease that is bankrupting our national medical system. And I think that that still translates today in terms of the work that we can continue to do, but also to build off of the legacy of the NIH Revitalization Act and all of the work that's being done in women's health. So I just want to ask you sort of how can we, as the Society for Women's Health Research, but also as researchers, policymakers, patients, and women, ensure that the intent and the purpose of this legislation and all of the work that's been done over the last 30 years is being met today and into the future?
Well, I think one of the key points here is that it's always under threat. It's always under threat because of priorities, reactionary issues. I think that probably everyone on this meeting knows an example. I think that what we have found is that it's not even 30 years later, the whole dream hasn't been realized. It took a report by the National Academy of Medicine to say, yeah, it's part of women's health, sex differences are there and matter. Now, in 2014, the NIH, under the, Janine Clayton's Office of Women's Health, got sex differences to be important. And still, people don't get it, that the differences can be used as a way of understanding the medical process or the disease process or the syndrome process or however you want to phrase it. But that these differences are not just important to look at how men and women do things, or how they get disease or how they're affected, but to realize that those differences can help us understand the whole process of illness and therefore be used as a tool to treat it. Now that's getting a little in the weeds, but in fact, that's one of the reasons that diversity is important. I mean, in 1987, diversity had a different meaning than it does today. Mm-hmm. And it was mainly women versus men, or even one group of men versus another group of men, like white male doctors versus other males. So today we now know that these types of issues are critical. And just as a simple example, the fact that there were women in Congress made a difference. They understood this. So I think that this is a model for how you get these issues before the public and before the scientists. We also have the wonderful fact that women started pouring into the medical profession in the 1990s. And like anything else, are interested in how it affects them. I mean, it's if you're not interested in that, you're probably not going to be interested in medicine at all. Just let me get a little bit of water. So I think that, as AIDS activism showed us that a group could be active, women's activism has showed us that all kinds of issues can be taken seriously and are of value and importance. So it's pretty exciting. I mean, now we have this emphasis on personalized care, and here at UTA, where I'm got pulled out of retirement to work, I deal with the Genomics Center and genomes and differences between individuals, not necessarily men or women, but all of those things are important.
Yeah. No, I think you're exactly right. And I think it is exciting. And I think the opportunity is here to really think about sort of what does this future look like and how do we make sure we're building on the foundation, the legacy. So thank you so much, Florence, for taking the time, for joining us for this conversation. I would invite the audience to make sure that you visit us at our website, swhr.org, to learn more, hear more, and connect with us on social media as well. And we will send out a recording to all registrants, and we'll make sure that we're passing along all of that. And please, please, please be on the lookout so that you can share it with others as well. So thank you all again for taking the time. Florence, again, thank you so much. I think it's really, again, a very exciting place for us to be in the women's health research